showcases the work of Jewish and Israeli organizations working in India on the current COVID crisis. My name is Diana Ginsberg, and I am the CEO of OLAM, which is a network of over 50 Jewish and Israeli organizations working in the fields of global service, international development, and humanitarian aid. OLAM convenes and mobilizes Jewish leaders and organizations in support of the world's most vulnerable people. Yesterday, India recorded the pandemic's highest daily death toll for a single country. Since the start of the pandemic, India has had over 25 million cases of coronavirus, and just yesterday, there were over 276,000 infections in one day. Today, over the course of the next hour, we will hear from 4 OLAM partner organizations: American Jewish World Service, Gabriel Project Mumbai, JDC, and Sandara, each of which has worked in India for many years and has long-standing partnerships and relationships with local communities. Each speaker will give a presentation about their work, and at the end, we will have time for questions and answers. In addition to the 4 from the organizations I just listed, I'm also honored to mention 3 other OLAM partner organizations which also have active fundraising campaigns related to meeting the needs of India at this moment. And those are Israel Aid, Tzedek, and World Jewish Relief. We will be including in the chat a document that includes the links to all of the fundraising campaigns of all 7 organizations. What is needed most at this moment is funding, and just a few dollars or pounds or shekels or whatever other currency can go a long way to make a real difference at this moment. As you will hear in the presentations, each one of the organizations on this call has a slightly different focus in India, whether it's in a different geographic region or with a different community. And many of the organizations work in close collaboration with and or partnership with each other. And so I would encourage you to consider making a donation to support at least one, if not more, of their work, so that collectively we as a Jewish community can be involved in this very important cause at this time. This year has been a year where it's been clear that there are compounded crises, and this point was brought home to us in the planning of this very webinar. And so our first speaker today, Taiza Deis, from Gabriel Project Mumbai, is unfortunately not meeting with us in person, but has sent a recorded video because the place where she's located in India, north of Mumbai, was hit by a cyclone, and she's been without power for the past 48 hours and went to great lengths to share a video with us. And of course, several of our partners are headquartered in Israel, where I myself am based. And despite a very difficult situation at home, have been working nonstop to meet the needs of vulnerable populations around the world. And for this, we are deeply grateful. Over the course of the call, we ask that you please keep yourselves on mute unless you are speaking during the question and answer component at the end of the call. Even though most of the call is going to be frontal, we would like this to have an intimate feel as much as possible. So if you are able, please keep your cameras on. And in the spirit of intimacy, we encourage you to please introduce yourself and indicate why you've joined us here today in the chat. If you haven't yet done so, please do so at this time. It is now my pleasure to hand over to my colleague, Yael Shapira, our Director of Network Engagement and Programs, who will be facilitating the rest of the webinar.
Hi, everyone. Thank you, Diana. It's great to see you all. Thanks for coming in mid-morning, late in the evening. And particularly thank you to those in Israel who are going through a tough time, and our thoughts are all with you. So as Diana said, I'm Yael Shapira, OLAM's Director of Network Engagement and Programs based in Washington, DC. And I'm so honored to present our speakers for today's webinar that represent 4 of OLAM's partner organizations. They are all very busy with working on what's happening in India and in other countries in which they work. So thank you so much for your time to our speakers today. Each speaker will present for about 7 minutes about their experience working in India and how their organization is responding to the COVID crisis. As Diana said, we already put the link in the chat for a document that has all the donation links for OLAM partner organizations working in India right now. We will share the link in the chat again later on. So Diana mentioned we will be starting off today by hearing a pre-recorded presentation by Taiza Diaz, Programs Development, or sorry, Senior Manager at Gabriel Project Mumbai, or GPM. Unfortunately, she can't join us live, but we are really happy to still hear her voice from India. Following the presentations, we're also pleased to have Jacob Stokman, the founding director of Gabriel Project Mumbai, who will join in Taiza's place in order to answer any questions you may have about their work. Following the first presentation, we will hear from 3 others. From Sam Wolthouse, Associate Vice President of Programs at American Jewish World Service, or AJWS, Aaron Zykis, founder at Sandara, and Leora Wine, Program Manager at JDC Grid. So we will go through the 4 of them, hearing presentation, and then I will ask them a quick round before we open it up for Q&A. So they will share their unique perspectives. And again, if you have any questions, please put them in the chat or wait till the Q&A section at the end. You can direct your questions to someone specific or just ask a general question. So without further ado, I will pass it over to Taiza.
Hello, everyone. I was really looking forward to joining this webinar in person. Unfortunately, a few days ago, Palghar district in Maharashtra, where I live, was struck by Cyclone Torte, and things haven't really returned to normal as yet. But moving on to the topic of the day, bear with me a second while I pull up my presentation. So, before we deep dive into GPM's response to the COVID-19 situation here in India, let's have a quick look at the pre-COVID distribution of doctors around the country. Now remember, India has a total population of 1.37 billion people, 35% of whom live in urban India and 65% who live in rural India. 80% of the doctors serve the urban population and only 20% of doctors serve the rural population. In such a situation, when the cases of COVID-19 started increasing in the villages, the resources, both human and infrastructural, were severely strained. Let's face the fact. COVID-19 has reached the villages of India. It's widely spreading among the 65% of our population who is least equipped in manpower or infrastructure to handle this. More personally for GPM, it has not only reached our communities in Palghar district, whom we have been serving since the last 8 years, but it has hit many of our own team members, 6 of whom were diagnosed COVID positive. Let me introduce you to one person from our team, Kunda Jadhav. Kunda is one of our cooks in the community kitchen in Palghar, who has woken up tirelessly at 4 a.m. every morning to prepare meals for the 500 children in GPM classes. Today, she is distraught and worried for her children. Her husband, Vinod, had been unwell for a few days before he got tested for coronavirus. His rapid antigen test declared him COVID negative. He returned home only to feel breathless and rush back to the hospital a few days later. By the time they waited for a bed, it was too late. Vinod lost his life. 2 days later, Kunda's father succumbed to COVID 19 too. A few weeks later, her house is severely damaged by Cyclone Torte. This is her story, but this is also the story of almost every second house in Ashte village in Palghar district. It is a reality of the hardships faced by our communities, but it is also the hardships faced by all GPM staff living in these communities. So, yes, this is personal. And this is why, despite the risk involved, our GPM team has been stepping out to serve, to help people and also hospitals that are in need of life saving equipment and medical staff. Here is a picture of two of our GPM team members, Jimson and Stephen, dropping off medical equipment and making a site assessment for an oxygen plant at Rural Hospital Mangaon and Rural Hospital Mokhada. Stephen goes back home to a wife and a newborn baby. Despite the risk involved, he hasn't turned down a single task. So, in response to this crisis, Gabriel Project created COVER. COVER Palghar is short for COVID-19 Emergency Response Palghar and is specifically designed to address the second deadly wave of the coronavirus. It is a two-pronged approach. The first approach provides medical infrastructure and personnel to government hospitals. The second focuses on community outreach programs. Both the approaches are not disparate, but rather they are connected and support each other to save lives. Let's look at both these approaches in detail. Here, the outer green ring represents the key elements of the first approach of medical infrastructure support. The objective here is to strengthen the existing government infrastructure in order to treat the increasing number of COVID-19 patients. This aspect of the project will focus on 20 government designated COVID hospitals that treat the rural poor free of cost. 2 hospitals have been selected, and the work to set up an oxygen plant as well as power backup for 60 beds is underway. These hospitals have already received the first round of vital small medical equipment, masks, soap, etc. And our team is working around the clock to source and distribute these items to all the hospitals. We are also working on setting up ambulance services. Nurses are being shortlisted as we speak to serve as additional medical staff at these hospitals. Visual aids are being printed for all 20 hospitals, and 4 hospitals will receive them by the end of this week. The yellow circle represents the various aspects of community outreach. Its objective being to increase knowledge and awareness about all aspects of COVID-19, including vaccination. The community outreach program will be ramped up from 3,000 to 12,000 people in the tribal communities in Palghar. The program will include mobile awareness vehicles, awareness posters, food kits with training on appropriate quarantining at home, health and medical kits that include soap, mask, important vitamin supplements, and other items. Local vehicles will be enlisted as first response vehicles to bring people to hospitals. Promoting vaccination for all is of utmost importance if we're going to curtail the spread and prevent further mutations of the virus. Gabriel Project has started to create spaces and support the government with facilities like refrigeration, food, water, and additional staff for the vaccination centers. We're also exploring the possibility of mobile vaccination vans to reach those who are old, infirmed, or who cannot leave their homes to be vaccinated. We know that we can't do this all alone. It is only in partnership with organizations and individuals that our local teams at GPM can work to alleviate the suffering of rural communities. Together, we can save lives. Thank you.
Great. Thank you to Taiza, who is not with us right now, but great to hear her perspective from the ground and the great work that's being done. I will now pass it around to Sam from American Jewish World Service to share about your own experience and work. Sam?
Great. Yeah, thank you, Yael and Diana and the entire OLAM team for hosting this very important webinar. As you all know, the situation in India is tragic. Between the recent cyclone and another one coming soon, they keep getting, they can't catch a break. So this is a really important time to be talking about India. I would not be doing my due diligence if I also didn't note, though, the spread in the region. We're quite concerned about the third waves in both places like Sri Lanka and Thailand and even Cambodia. So just be mindful of the fact that India is one place in the global context that's really struggling right now. So with that said, because most of my colleagues will be talking more about the health crisis in India, I'm going to focus on the aspects of the crisis that we don't hear nearly as much about, and that's the secondary effects of this pandemic. As you may know, AJWS is a human rights organization working in 18 countries globally. In addition to supporting local organizations working on sexual health and rights, civil and political rights, land, water, climate justice, we also respond to humanitarian crises worldwide. We do this by supporting our local partners that we've been working with for decades to respond to crises taking place in their communities. We believe strongly that local communities who are experiencing the crises themselves must be in the driver's seat and should dictate the response, not because they have access to those communities and know them best, but because they have the right to inform and lead all humanitarian response. They know the dynamics, the local culture, the language, and the needs of the communities best. In the case of India, where AJWS has been working for decades, we're supporting over 80 groups to respond to this pandemic, over which half are women-led groups. In the next few minutes, I'm going to take you through the context of what's happening today in India, again, focusing on the secondary effects of the pandemic. And I'll give you a sense of how our partners are responding. And then I'm going to end and talk a little bit about our advocacy efforts, both in India, as well as with our US government affairs team based in Washington, DC. Next slide, please. So a little bit about the context. In addition to the alarmingly high rates of COVID infections and deaths, as we talked about earlier in this presentation, just yesterday, India beat a world record and over 4,500 people died from COVID. The secondary effects of this pandemic have been catastrophic as well. We at AJWS have been paying particular attention to the loss of livelihoods, mounting food insecurity, alarming rates of gender-based violence, and rising authoritarianism that is having a horrific impact on communities that we work with. To give you a sense of the impact, over 200 million migrant workers have lost their livelihoods. These workers live hand to mouth and in many cases are excluded from mainstream response as they are from lower caste communities. Global trends, as all of you know, have indicated that rates of sexual and gender-based violence have increased exponentially as a result of COVID-related lockdowns. India is no exception to this. We've heard firsthand from our partners who are operating hotlines for survivors of violence that there's been a significant increase in calls throughout the pandemic as many people are trapped in their homes with their abusers. This also speaks to the importance of providing mental health support and psychosocial support during this time, which our partners are providing. And as many of you know, and similar to other countries, authoritarian leaders such as Modi in India are using COVID to not only consolidate power, but also to politicize aid. In the case of India, there has been an inequitable distribution of oxygen and vital medical support in regions where he doesn't have popular support. Additionally, the current government of India under Modi's leadership has worked tirelessly to curb freedom of speech, insisting that Facebook, Instagram, and Twitter take down any posts critical of the government's response or lack thereof to COVID-19. Next slide, please. So what are our partners doing to respond to this catastrophic situation? Again, we have over 80 local partners throughout the country. Like many of my colleagues on this panel, we're supporting the provision of basic needs, such as access to food and medicine and cash. And it's important to note that cash transfers have been particularly invaluable during this time, as money can safely be transferred using just mobile phones. And using this method, our partners have actually been able to prepay for medicines at pharmacies for community members, which has been particularly important for those who are most vulnerable, such as women living with disabilities or even women-led households. As noted earlier, mounting food insecurity is a real issue both in India and globally. And recognizing that the effects of the pandemic will endure after cases have dropped, we've prioritized support for building community resilience around food security so that we're not just relying and communities aren't relying on one-time food handouts. So instead, we're prioritizing support for community gardens and for community kitchens. As noted, we are continuing to respond to the increase of cases of sexual and gender-based violence. We're funding psychosocial and mental health support, legal support for survivors who are seeking legal recourse. We are also supporting hotlines, as I noted earlier, and safe houses. And information dissemination has been critical. An example of what we're doing for this is partners are not only informing communities of available services, but also debunking myths about the vaccine. For example, and particularly in rural communities, many people do not want to get vaccinated because they think it will make them and their family members sick. So our partners are doing campaigns and awareness raising efforts to promote vaccinations, which will be incredibly important as those vaccinations become more accessible in the country. And now, as noted earlier, I want to focus on our advocacy efforts. I think this is something that sets AGWS apart from many other humanitarian organizations. So our partners in India are advocating at both the local and national level, particularly around two very important points. The first is access to government-sponsored relief programs for rations and provision of basic needs. And this is particularly important for women-led households, transgender people, Dalit communities, and migrant communities who often don't have the ration card or proper identification. So our partners are advocating that they have equal access to those rations. The second piece that our partners are continuing to advocate for is the equitable distribution of the vaccine, as the governments, as noted with the oxygen, have been prioritizing certain communities. Not only are our partners in India working on advocacy initiatives, but our colleagues in Washington, D.C. are also pushing Congress and the administration to act. So AGWS has pushed for the increase of distribution of vaccines to the global south. We've advocated that LGBTQI communities and others be included in funding allocations from USAID and others. And lastly, we're continuing to push for accountability for rights violations that are committed as a result and during this pandemic. I'm very excited to let you know that we have some of my advocacy colleagues on this call. So if you have any questions after the presentations, I'm sure I or any of them would be happy to answer their questions. So thank you again for having us, and I will turn it back over to Yael.
Thank you so much, Sam. Just amazing to hear how complex this is and how many layers beyond just the health aspect of COVID. It's quite alarming to hear. I'm passing it along to Erin to hear about Sandara's work in India.
Thank you so much, Yael. It's really great to be on this call with everyone. And I'm so grateful to all of you for doing work in this time of really just heartbreaking need. I also want to just start off by saying that it's really only because of my Jewish network and organizations like OLAM that Sandara is in India and exists in the first place. And many of you don't know, but the first person I met in India is Jacob Stockman, who you will hear from, the founder of Gabriel Project Mumbai. And he is a dear friend and mentor, and he really took me under his wing. to make it so that Sandara has been able to operate in India for the last 8 years. And I share this because it is very true that wherever you go, there's always someone Jewish, even in Mumbai. And I think it also really speaks to the nature of this community in trying to help each other out, and really working together on the same goal. And I have always been inspired by the work that Gabriel Project Mumbai does and continues to do to this day. So just really wanting to share the love and gratitude with this organization. And so as I said, Sandara has been operating in India for the last 8 years. The main work that we really focused on was recycling hotel soap from 4- and 5-star hotels, chemically reprocessing it into new soap, hiring women to do this work, and then distributing it to people mainly in tribal districts who live on less than $1 or $2 a day, and really focusing on the provision of hygiene education into communities where there really is none. And since then, Sandara has taken, since the pandemic, Sandara has taken a new approach where we support local entrepreneurs, mainly female entrepreneurs who are working in issues of health, hygiene, water, sanitation, and waste management, so that we like to really empower local leaders to do the work. We come alongside them with funding, with mentorship and coaching and access to trainings that they would otherwise not have access to. But when the crisis hit India, we felt that as a community that has worked in India for so long, we have a real need to respond. And so I'd love to tell you about some of the work that we are currently doing with our OLAM partners and with other organizations. So as Sam has said so nicely, it's really important that at this time we are supporting people on the ground who are living in this crisis and telling us what the needs are. And so we've really tried to focus our approach on people who are living on less than $3 a day, because like in the US, I'm here in New York, what we saw is that unfortunately, the pandemic really hits the poor much harder. And so we need to be focusing our efforts there. We have focused our efforts mainly in Bangalore and also in Mumbai. So in Bangalore, we have a RISE fellow who is developing a toilet that recycles urine and feces into bio waste and sells it to female farmers. And she actually had to put her work on pause because of the pandemic, but really quickly pivoted into distributing monthly food kits to daily wage earners who are out of work. And those food kits contain soap and menstrual hygiene kits and things that we really need to get to families who are unable to provide for themselves, and also families who are immunocompromised or who are simply afraid to leave the house right now. So she transitioned into doing this, and we're supporting her with that. We are also at the same time paying the salaries of nurses and doctors so that they can go in and provide critical care to communities. I think, they are doing so much work and are so drained and are often overworked and underpaid, and we are trying to come in and support them. We are also supporting a 50-bed care center in Bangalore that is set up sort of as this emergency setup to get oxygen to folks who are currently waiting for a hospital bed. So you might have heard about all these apps that are now springing up to alert people about when there are open hospital beds. I mean, you take a city like Mumbai with over 20 million residents, and the last time I checked, there were 67 open hospital beds. So we are supporting innovations that are springing up to really provide life-saving oxygen and medicine and care to patients like this. In Mumbai, we are working with Gabriel Project to distribute 40,000 bars of soap to hospitals who have run out of supply. We're also distributing 3-ply face masks and reusable cloth face masks. We're very excited about being able to provide things like that. we are working with another organization to staff a mobile clinic for about 2,000 people each month. And this mobile clinic really goes to people who otherwise wouldn't be able to get themselves to a hospital, and provides free rapid PCR tests, free medicine, oxygen, and just like critical care for people who otherwise cannot get themselves into hospitals. And I think that's an important thing to highlight. People are running out of ambulances. I've heard horror stories about people having to take Ubers or put bodies in the backs of Ubers and Ola cabs to get them to the hospitals or to get them to crematoriums. And so I think that transportation is something that is often overlooked. Here in the US, we don't have to worry about that. But in India, it's a different story. And so we're really trying to provide immediate and free transportation to hospitals. And when that isn't available, we are trying to get the care to people in need. And as Sam said, direct cash transfers are, I think, revolutionary and need to be, we need to adopt it even more right now. So we have set up a bereavement fund to support families who have lost a breadwinner for 3 months, to help them out buying groceries, anything that they need, because this has been so economically devastating for families that are already just struggling to survive. So it's really taking families and pushing them into deeper poverty. And we really don't want to see that. So we have set up this bereavement fund to reach out to these families in need. And I think what I want to reiterate is that, India was in the news cycle, and the crisis continues just because the news cycle has moved on to other things. And we are committed to being there. And I know all of our partners are as well. So this is something just to know that just because it's not as much in the news anymore, the crisis continues. We will be there for a long time. And I know that our partners will be as well. And it's just, I'm incredibly grateful to our partners on this call, and especially to GPM for doing this incredible community work right now.
Thank you so much, Erin. It's amazing to think about all these topics like transportation or hygiene that aren't, sexy topics that people want to hear about or talk about. And it's great that you're answering those needs as well. To finish off with our last presenter, I will pass it along to Leora from JDC to hear about your work. Thank you.
Thanks, Yael. Hi, everybody. So just to start off, I wanted to say, for those of you that may not know, JDC is a over 100-year-old Jewish humanitarian aid organization whose mission is to help Jews wherever they are around the world and to provide a Jewish response to global crisis including pandemics and COVID-19. I'm just going to share a couple of slides to keep you guys awake. Just 1 second. Okay. So as you heard from Teza speak before, and as we heard from our partners, the Indian healthcare system is overburdened, to say the least. There is not enough equipment, there's not enough oxygen, not enough medical personnel to really meet the demand. This is a message that we did hear from all of our partners, including those in the Jewish community in Mumbai, the Israeli consulate, and from community partners that we've worked with for many years in Ahmedabad, Gujarat. JDC has been working in India for over 50 years. And today there's an approximately 4,500 Jews living in India, the majority of which are living in Mumbai. And while JDC continues to look after them, we also recognize that here the needs are just much greater. Really, they're affecting everyone, as all of our partners on the call have said. So with the disaster of this proportion, we have to be strategic in how we respond. And so JDC is focusing our efforts on 3 areas where we see that we can act quickly and really meet needs. The first area is bringing in medical equipment. Through our consultations with the Jewish community and other local partners, we got in touch with hospitals, both in Mumbai and in Ahmedabad, and understood that mid-sized portable ventilators are in high demand. We connected with an Israeli company who manufactures these ventilators that are battery operated and can also be connected to electricity. These ventilators are made for hospital use, but they can also travel in between departments, and they can also be used in ambulances. It's important for me to say that this entire process was done very quickly. Within less than 1 week, these ventilators left a warehouse in Petah Tikva in Israel and were installed in hospitals in Mumbai and in Ahmedabad. We started this pilot small, just to make sure that the entire mechanism worked, right? That our ventilators got to India, they got released from customs, and that they were installed. And now we are scaling up and also branching out. Just today, our second batch of ventilators cleared customs and are en route to various hospitals. And this was no easy task, as Diana alluded to in the beginning regarding the situation in Israel. A number of flights were canceled, including the one that these ventilators were supposed to go on. And so we had to reroute them to find a flight that did leave. And so here, when equipment is needed, we were able to find that need and then bring it in. But we will always look for local solutions wherever possible. And so that's why our second intervention is looking at Indian telemedicine. India has a large amount of high tech and med tech that we are tapping into through telemedicine ICU platforms. Indian doctors can remotely monitor ICU patients to add human capacity and expertise to a healthcare system that is in need of extra support. Through just one camera, ICU doctors that are based in one part of India can monitor 10 beds, which can be used in an ICU ward anywhere in the country. As you saw from Tay's presentation, a lot of the rural hospitals don't have this expertise. And so we're able to make that connection. And while we're looking to help those who are at highest risk, like those in the ICU wards, we are also working on a community level through our local partners who know how to reach those who otherwise may not get any assistance. And that's why our third area of focus is working with our longtime partner, Sewa, the Self-Employed Women's Association. Sewa is a network of informal women workers spread across the state of Gujarat, headquartered in Ahmedabad. And if a year ago they were telling us that the concern that COVID had caused was about livelihood, now they're saying it's about life. They're talking about having it being a real fear, and that awareness and knowledge is what fights this fear. So through the Sewa network, we're training over 20 women community leaders on best practices for COVID-19 prevention and equipping them with oximeters and other basic medical supplies so that they can aid their communities, reaching over 20,000 people. Now, these leaders were also linked to a helpline that we established together with them. And this helpline connects medical professionals to women in rural areas who otherwise would have no access and no communication with any doctors. So far, many of the callers have been looking for mental support, just a listening ear. If there's one thing that I have learned about responding to disasters at JDC, it's that partnership is the secret to success. And I just must say that I'm honored to be working with so many amazing partners to carry out this mission. So thanks.
Thank you so much, Leora. It's just amazing all the different themes and topics that we've heard, from gender-based violence to advocacy to hospital equipment, poverty, the need for cash. Again, there's just so many layers here. And before we open up to questions, I'd like to just have a quick round, each of you answer in 1 minute. How will donation funds to your organization be used to support people in India? I know some of you shared, where this money is going, but for those today who are on the call and would love to donate, where would this money go in your organization? Or what is your greatest need right now, and how can we be helpful? So I'm going to go in reverse order for quick answer, starting with Leora.
Okay, so just to say very quickly, funding would go to 3 main things: purchasing more ventilators, $10,000 can get a ventilator; covering more ICU beds through telemedicine, $5,000 can fund that for a month in one place; and reaching more women leaders in communities across Gujarat. And with $2,000, we can reach more communities. So thanks.
Thanks, Leora. Erin?
We are actively fundraising right now to support another mobile medical clinic, and we're hoping to distribute vaccines shortly. So working on that. And then we also are looking at getting 5-liter and 10-liter oxygen concentrators. So to these hospitals in need. So that's where the money would go.
Thanks, Erin. Sam?
Yeah, a couple of things. As noted, we have 80 local partners that are responding to the pandemic, so this money goes directly to them. I think an important piece to note, not only about the provision of basic needs and to respond to the pandemic itself, but again, the secondary effects, which will far outlast this pandemic. This is going to be an issue for years to come, especially around food insecurity and livelihoods, which we'll be prioritizing through making multi-year grants, 3 years plus. The second piece, I just want to make a call out again, the way I started, that this in India is getting a lot of international attention and a lot of attention from all of our organizations. Please be mindful of the region and the global context. I'm particularly concerned about Nepal and want to think about World Jewish Relief, who is on this call and doing amazing work in Nepal and other organizations. We work in Sri Lanka, which is also experiencing a surge. So just keeping in mind, India is a huge problem, but the rest of the region is also experiencing a surge. Thank you.
Thanks, Sam. I hope we will all learn lessons from this response to make sure that this doesn't spread to other regions around the world. And finally, Jacob.
Hi, everyone. So we're actively trying to raise funds, and we're with our partners on the ground, IsraAid, to access emergency medical equipment. We do it as best as we can locally, finding vendors locally to access the emergency medical equipment. Specifically now, we're concentrating on opening our own vaccination center in conjunction with the district health officer in Palghar, in a district called Mokhada. The vaccinations are, as you might hear in the news, there's a lack of vaccinations. There's black market vaccinations being sold, and so we would like to go ahead and for only $10 we can vaccinate an individual in the rural villages and try to stop the spread of COVID-19. I think that we all know from our own countries how the vaccinations work.
Thank you so much. Now that a lot of us, especially here in the US, have been vaccinated, it's so easy to think that life is gonna go back to normal. But so many around the world don't have access to such a wonderful resource that we got here for free. So thank you so much to all the speakers. Really, really interesting. And I'm just so honored to have you here and hear about all your good work. We have one question so far, but I encourage people to write some more questions, or you can unmute yourself if you feel like it and ask in person. I'll direct this one to Leora. There was a question if the Israeli government is supplying some of their reportedly large stock of emergency equipment for use in India.
So we're in constant contact with them, and they're running their own response. It's important to say that they're working, I think, mainly in Delhi, and our focus has been more in Mumbai and in Gujarat. So I don't know where the status is, but we're mostly in contact with the Mumbai consulate there. Israeli government, for the government, they're working government to government, and JDC is working as an organization together with other organizations and companies. So while we do consult and share information, much like we do with other partners here, our responses aren't coordinated together.
Thank you. I will open it up for questions. We have about 10 or so minutes. You feel free to unmute yourself or use the raise hand function. In the meantime, I will ask a question to whoever. Feel free, the speakers, to unmute yourself and answer. But in terms of kind of travel restrictions for India right now, I know the US, UK, many other countries have closed their borders to people from India. Do you know what the policy, how that has affected people, but also do you think that will change anytime soon? And what does it mean for Indians who are kind of stuck? Is there also movement within the country, etc.?
I can say that from the partners that we speak to on the ground, there are curfews that are in place. And in some places, so like a nightly curfew at 8 p.m. In some places it is more enforced, in some places it is less enforced. So traveling between countries, between states or between areas, if you have a curfew pass, you can go in between. But otherwise, our partners are very aware that they have to get home before 8 o'clock, but I can't speak to coming in and out of the country.
I'm happy to speak a little bit. It'll be a bit of a tangent, but I will get to your response, Yael. I think we saw this when the whole world was under heavy lockdowns last spring, right? Borders were closed everywhere. And as we think about shifting the humanitarian sector to becoming more locally led and less top down, less about the international organizations or the UN agencies, I think this is an important time to really push and remind people that those who are local grassroots organizations are always on the front lines of these crises. And we should stop assuming that we should go around them, but instead support them, because they're going to be there long after we leave or when we can't get there when the next pandemic comes. So again, I think it just highlights the importance of supporting locally led partners who are on the ground.
Thank you so much. No one has raised their hand. Just going to give an opportunity for questions. Let's see. So here's a question in the chat. One of the most searing images that Robin has seen is the overflow of the crematoria and the rivers. How can this aspect be managed for environmental impact? Thank you, Robin. Does anyone have experience with your partners on the ground around this terrible images with the crematoria?
I can't speak to the crematoria, but I can just talk about it just in general in terms about hygiene and prevention. And a lot of the partners here have talked about that before, as Sam was saying, when the rest of the world was dealing with it and the people in the villages in India, it wasn't on their radar, much like it is in other countries in which a lot of us work in, that COVID is just so far down the line, it's not really there. And now it's starting new variants, and with more time having gone by, it's becoming more and more important to deal with. And one of the ways in which JDC works with our local partners is in terms of just messaging about hygiene, about what to do, messages that also put it in pictorial format for kids and put it obviously in local languages, but even in no language, that people can understand how the importance of hygiene, especially as more situations like this are coming up. So just the idea about awareness and being able to talk about it in both a culturally sensitive but also age sensitive way is something that we've seen both in India and elsewhere that we work around the world.
Thanks, Leora. We got another question about how are the federations and foundations supporting this region? I think I'll take it to both how is a Jewish community globally supporting this, but also generally if you're seeing big shifts in general foundations and philanthropy around this issue. Is there anyone who would like to take this one?
I mean, I'd like to say that we've been very lucky that Gabriel Project Mumbai has been given allocated funds from the UJ Federation of New York, as I know JDC has as well. And there's been an outpouring of donations that we've received, and I'm sure others as well, from the Jewish community and from beyond. Our partnering with IsraAid is an incredible boost for us as the implementing partner for IsraAid and working with them as well. So I see a lot of support from the Jewish community, and I really commend the Jewish community for doing that. There's a lot more to do. And I want to just say one thing. Sam was talking about supporting local organizations, and I agree with that. And as a local organization, because we've been there in the slums and in the villages already for over 8 years, we see what's happening, and very personally, our staff are the people who have contracted COVID-19. We've seen 6 people have received that. We see our friends and our communities. We're working in 47 village areas, as well as in a very large slums. So hearing what's happening on the ground, like Sam said beforehand, from local partners of other organizations and from us as that local partner is vital. And I just want to commend all of the different people on the organizations that are doing the work in COVID-19, for all of you stressing the fact that listening to local voices, and in our case, the local people being the leaders of our organization, it's so important. And so I just want to thank you and thank OLAM for this webinar.
Thank you, Jacob. That leads to another question. So now that COVID in India is, of course, tragically front of mind for so many, what can we do to raise attention and funds for this important issue once it falls from the headlines and the needs remain?
I'm happy to talk more about this. I think the reality is 1 out of 5 people in this globe live in India. And so many of us owe so much of our life to things that India has given to the world. So I see that this is a point where we realize that what happens there actually does very much impact us. And I also think that wherever the variants travel after this will be very hard hit. So it's sort of like, this is our opportunity to manage a crisis before it really spreads out, which I know, unfortunately, it is doing already. And so I look at this like, we have to tackle the issue where it is. And we're all connected in this world. And I think about how, just personally, when New York was going through such a crisis over a year ago, so many of my Indian friends reached out to check in on me and ask what they could do to help. And so I feel like this is our opportunity to really pay it forward. And we have to keep reminding people that just because the news cycle moves on, the crisis isn't over. So more things like this to really make people aware of what's going on the ground and hear directly from folks who are on the ground, I think is very critical. And, inviting your friends to talk about it and share and keep reading the news and, keep ourselves updated about this is so important.
Thank you, Leora.
Yeah, I also just wanted to add about, in the world that we live in, and we talked about this earlier, I think Sam mentioned it, about global being local and local being global. Right now it's India, but it's actually not just India, it's other places as well. It's happening in so many places. And so just, we're all, what happened in what we saw in Israel that, went through it first, and then in America, how it lasted longer. And the way it's circling back, that everybody has their own role to play in it. And if they can talk about it in any way that that it speaks to them about, whether it is reading the news or whether it is talking about it at a family, whatever the issue is, to keep it in their dialogue, in their discourse, I think that's the best service that you can do to make sure that everybody hears about it and about equity and about all of the other, about vaccinations, just to keep it in the forefront of your minds.
Thank you. So I'll just ask the last 2 questions here before we'll close. So someone asked, are you interested in supporting people in Bihar, in that region of India? So if any of your organizations is working or plans to work there. And there's a question about whether COVID-19 is the commonly used word for the illness, or is there another way that people refer to the illness? And I'll expand on this question and just ask, in terms of the language diversity in India, has that been a barrier for information and raising awareness? How are people managing just that communication or lack thereof?
I think I'm happy to answer that last one, Yael. I have also heard it referenced as Corona more than COVID, so I think both. And the last thing I'll say about that is that this has been an issue globally, right? When the WHO and others have disseminated information about the spread of COVID and how to protect oneself, it's often been in commonly used languages, not in local dialects, and certainly not in dialects used by more rural or indigenous communities. So ATWS actually created toolkits that we disseminated to partners in rural areas to help curb the misinformation that was happening, and also to spread information about how they can protect themselves and others. But this is a huge issue that we need to be thinking about. And I think I mentioned it in my presentation, information dissemination also about access to services has been critically important during this time.
Thank you so much. Again, really interesting to hear. And I do hope that people who are on this call will take time to go to the websites of these organizations. Graham will drop the link to the document once more. In addition to the 4 organizations represented here by the speakers, some other OLAM partners are doing great work and fundraising for India, including World Jewish Relief, Tzedek, and IsraAid. So please be sure to check out their websites as well. And we really hope that this wakes us all up and, make sure that we're going to respond to COVID equitably, because it affects us all no matter where we are in the world. And with that, if you have any questions about OLAM, feel free to get in touch with me. I emailed most of you. And thank you so much for taking the time to be with us today, both the speakers and Taiza in India and all of you who participated. So wishing you all health and safety, and we hope to see you again soon. Thank you so much.
Thank you, Yael.
Yeah.
Thank you.